we will have the lecture about the retina, and you have heard a lot about the structure of the eye and the related structures. Now we will focus on the retina. The retina is the innermost layer of the wall of the eyeball. Here you can see it with this yellowish color here on this posterior side, but here a little bit brownish color belongs to the retina. It is very important, and we should emphasize that the retina, together with the outgoing optic nerve, are parts of the central nervous system, and they are not components of the peripheral nervous system. They are components belonging to the central nervous system. We distinguish two main parts of the retina. They are this non-visual or blind retina and the visual or optic part of the retina. They are separated from each other by a circularly running line. This is the ora serrata. This is what we see here. Or in case of this image, you could also see this ora serrata, which is the border between these two parts, blind and optic part of the retina. If we see these parts of the retina, first we see the blind part. In this case, we have two different portions of the blind part of the retina. The iridical part is found on the posterior side of the iris. The ciliary part is found on the ciliary body. Here you can also see the ora serrata again, giving the border between the blind part and the optic part of the retina. In case of the blind part, we have only one layer of the retina, only pigment epithelial cells we have in the blind part of the retina. It is obviously visible that light rays coming in through the pupil could never reach the blind part of the retina. In contrast to the blind part, of course, here the optic part can already be reached by the light rays coming in through the pupil. So if we see the structure of the optic part, we will find not only one layer, but we will find 10 layers in the retina. And here we see this schematic version of the structure of the optic part of the retina. Here the light falls on this side, and then it will go through the retina layers. If we see the exact structure of these components, of the retina, of the optic part of the retina, where we distinguish these 10 layers, we will find 5 main neurons here. And these 5 main neurons are arranged in either vertical transmission route or in a transverse or horizontal transmission. The neurons or the members of the vertical transmission are listed here. The first one is the photosensitive photoreceptor cell, which could be either rod or cone. This is what we will see in details. So they are found here. Then the second one is the bipolar neuron, bipolar cell. This is the second neuron of the visual pathway as well. And then the third one is the ganglion cell, and they are members of the vertical transmission. Plus, we have at least two interneurons. We will mention these two interneurons today. These two interneurons are members of that horizontal system or lateral system, which is very important from point of view of enhancement of some functions of the retina. It is very important that the signal conduction happens in this direction. So from the photoreceptor cells to the bipolar cells and then to the ganglion cells, but light falls on the photoreceptor cells from this direction it means that light should go through almost all layers of the retina in order to reach the photoreceptor cells. That is what we call inverted retina. If we see the 10 layers in details, we would see these two images. On the left side, you can see the histological image. This is what you will see in the histology practice. Here we will see it. It is stained with HE. And on the right side, we see a sketch about these 10 layers. We number these layers from outside to inside. So this is the outermost layer of the retina sitting on the Bruch's membrane, which is the innermost layer of the choroid here. So this is the first layer, the retinal pigment, the epithelium. Then we have the second one containing the photoreceptor cells, exactly their segments, and then we will see it. Then we have two limiting membranes. The first one is located here. This is the third layer. The other one is already the innermost layer of the retina. This is the inner limiting membrane, and they are formed by these purple colored cells. They are the glial cells of the retina. We will see them in details later. Then we distinguish two plexiform, so-called plexiform layers. They are the areas where we have the synapses between the neurons. So here we have the synapse between the photoreceptor cells and the bipolar cells. A little bit simplified version is this, but we will talk about it a little bit later. So here we have the other layer with the synapses. This is the inner plexiform layer. Then we have the ganglion cells, and we have the axons of them. And on the next slide, we will see it a little bit more detailed. And here you can find exactly which structures are found in which layer. So here, in case of the next slide, we use only that sketch here. And then here you can see the names of the layers. And then here you find the structures which we can identify in these layers. The first one is the outermost one. This is the retinal pigment epithelium containing pigment epithelial cells, what you have already seen in histology 1 previously. The second layer is called the photoreceptor cell layer. In the photoreceptor cell layer, we can find both the outer and the inner segments of the photoreceptor cells, so of both the rods and cones. The third layer is the already before mentioned limiting membrane. This is the outer one. Here, this limiting membrane is formed by the end feet of these glial cells called the Müller cells. Between these end feet, we can find cell connections. They are adherent zonulae connections. In the fourth layer, we find the cell bodies of the photoreceptor cells. Then, of course, we will find the synaptic endings of these photoreceptor cells here, forming synapses with the bipolar cells. And then these synapses will be influenced by these light bluish cells. And these light bluish cells are the horizontal cells. So here we have these endings here. Then we have this nuclear layer. This is the inner nuclear layer where we have more different cell bodies. In this case, of course, we find this horizontal cell. We find the Müller cell, meaning the cell bodies of these cells. But we will find that the second neuron of the visual pathway here, which is the bipolar cell here. And we have another interneuron sitting in this, or with its cell body, sitting in this layer. This is the amacrine cell. So both the horizontal and the amacrine cell are parts of the horizontal transmission system. Then the next layer is already the other plexiform layer where we have synapses again. and then this is the inner plexiform layer. Then after the inner plexiform layer, we find the cell bodies of the neurons whose dendrites were visible in case of the inner plexiform. So these are the ganglion cells, and the ganglion cells will send their axons outside the retina, and these axons will form the optic nerve. Therefore, the ninth layer is the nerve fiber layer, where we have these axons, but at this level, these axons are not yet myelinated, so they are unmyelinated at this level. They will become myelinated only at the site where they will leave the eyeball. That is, there we have the exit of the optic nerve from the eyeball. And then here we have the other limiting membrane, which we have already mentioned. This is also formed by end feet of Müller cells, but here between these end feet, we have tight junctions, and these tight junctions will connect these end feet with each other. If we continue, we will see the members of the layers after each other from point of view of the system of the conduction of the signals in the retina. We are starting with the photoreceptors. The photoreceptors are the components of the retina which are photosensitive, and we distinguish two different photoreceptors. We have the cones. Here on the left side, you can see the cones, and we have the rods. They differ from from many points of view. The cones are the photoreceptors which are not so sensitive as the rods. Rods are more than 1,000 times sensitive than the cones, and they are very efficient photon traps. It is said that only one photon is enough to act on a rod. The cones can function only in daylight. Therefore, they are responsible for the daylight vision or photopic vision. The rods are more sensitive, and they can function in during the night as well, and they are responsible for the so-called night vision or scotopic vision. And these differences are the reason why during night we could not identify colors of objects, but we can see objects, but only in the grayscale. But we cannot identify the exact color of the objects. If we see these photoreceptors, we will distinguish different parts of the photoreceptors. In case of both, we have an outer segment here, and here we have discs formed by membranous lamellae here, and they are the discs of the photoreceptors. We have a difference between rods and cones. In case of the cones, the gaps between the discs communicate with the extracellular space. In contrast to the cones, in case of the rods, these discs are already fully detached from the cell membrane. Therefore, they are structures found inside the outer segment, and they cannot communicate, or the gaps between them cannot communicate with the outer environment. So they are the outer segments. These outer segments contain the so-called photopigments, and these photopigments will give the biochemical basis of the ability of the vision, and they are different in these photoreceptors. In case of the cones, we have 3 different types of iodopsin, which binds the retinal, which is the cofactor or prosthetic group of this photopigment. The amino acid sequence of the iodopsins differ, and this is the reason why we would distinguish these 3 different cones. We have cones which are sensitive to short wavelength light. They are these. So this means actually the blue color of the spectrum. And then we have such cones which are sensitive to medium wavelength of light. They are the green cones. And then we have cones which are sensitive to the long wavelength of the wavelength light of the spectrum. They are the red cones. From the cones, we have 6-7 million pieces. In contrast to the cones, in case of the rods, we have the photopigment called rhodopsin. Here, the amino acid sequence differs from that of the 3 different kinds of cones. And then we have also the prosthetic group of it, which is the cofactor of that photopigment. From the rods, we have more than from the cones, and these are the main photoreceptor type of the retina. However, from point of view of the sharp vision, the cones are the most important because they are responsible for the sharp vision, and we will see how this is this possible is. If we see the distribution of the photoreceptors, we will see that we have a very interesting distribution. We have the so-called central retina. Central retina is exactly the area what we call the fovea. I will show it where it is. And then in this central fovea, we find only cones. Okay, the cones were the photoreceptors which are color sensitive. So they are not only in the fovea, but most of them is found in the fovea. In the peripheral retina, we have less cones. In the peripheral retina, the rods dominate. Here you see that in the peripheral retina, which means actually only outside the fovea, we have many rods which are not color sensitive, and then the number of these rods will decrease if we go in the vicinity of the fovea, if we will be near the fovea, and then inside the fovea we have no rods. But if we leave the area of the fovea, the number of the rods will increase again. So the rods are for the scotopic vision. The fovea, the cones found mainly in the fovea are for the photopic vision. In case of this image, here you see how the cones are distributed in the retina. It means, of course, the fovea. And here we see the red, the green, and the blue cones. So the L, M, and S cones. And here we see that we have more or many red cones. We have a little bit less green, and then from the blue cones we have the quite few. In case this is a normal retina, here you see a protanope retina. Protanope means one type of color blindness. And in case of this color blindness, the cones of L type, being able to detect the red color, are missing. In this case, the person will have problem with the distinction of colors red, yellow, and green because of the lack of the red cones or cones of L-type. On the next slide, I will show you some pictures about these photoreceptors with the electron microscope. In case of this and these pictures, scanning electron microscope was used. And here we see the rods, here the outer segments exactly. And here we see the rods, outer segments and inner segments of rods, and these structures, these parts of the cones as well. In case of this is a transmission electron microscope image, and here we are seeing very good the discs, these membranous discs of the outer segment of a rod here. And then these membranous discs bind the photopigments, they contain the photopigments in the cell membrane. If we see a little bit the process of the phototransduction, we could see two different ways. This phototransduction is rather topic of the physiology, but we will say a few sentences about that phototransduction. So here on the left side, you see what during the dark happens here, so in the darkness, and here we see what happens if light hits the photoreceptor cells. In case of darkness, inside the outer segment of the rod, we have a high cGMP level. And this high cGMP level is very important from point of view of cation channels, and these cGMP dependent cation channels are kept open because of this high cGMP. Because these channels are open, sodium and calcium ions will flow in the outer segments, and hence depolarization will be caused in the outer segment, and this depolarizing ion flow we call the dark current. So in darkness we do have depolarization, and this depolarization leads to glutamate release. In contrast to the darkness, in case of light, if a photon hits the photoreceptor cell, if a photon hits the rod, in this case we will have a change here. So this is the change of the prosthetic group of the cofactor. This is the 11-cis retinol. But if light reaches the outer segment of the rod, this 11-cis retinol will be converted to all-trans retinol, and this will lead to the conformational change in the opsin part of the photopigment. This will activate the transducin, and here we will find them. So here we have, this is the photopigment, and then it will activate the transducin molecule here, and transducin will give some changes in the cGMP level with the activation of the cGMP phosphodiesterase enzyme, so the cGMP level will decrease. If we have less cGMP, these before mentioned cGMP dependent cation channels will close. Therefore, the sodium and calcium influx decreases. If we have less such ions, it will lead to hyperpolarization, and this hyperpolarization will decrease the glutamate release. So they are the different ways of the signal conduction in case of darkness and in case of light. So we have this phototransduction process. In the vicinity of these photoreceptor cells, we find the pigment epithelial cells. So this is what we have. So this epithelium is the epithelium what we have in the first layer. So these outer segments, what we have already talked about, were in the already in the second layer. In case of the first layer, we find the pigment epithelial cells. This is the section. This is the slide, what you have already seen in the first semester in histology 1. These are the cells here sitting on the Bruch's membrane, which is the outermost layer of the choroid. These pigment epithelial cells are firmly attached to the Bruch's membrane, and they have very important functions. The first thing is that, as you already know from histology 1, we have melanin granules inside, and these melanin granules are able to absorb excessive amount of light. With that, these cells will prevent the light reflection, which could worsen the image quality. Then these cells are found in the vicinity of these before mentioned outer segments. Here we have these lamellae, these lamellar units of the outer segments, which will be eliminated because we have a renewal of these outer segments, and these old lamellar segments will be phagocyted by these pigment epithelial cells. These pigment epithelial cells are connected to each other by tight junctions, and then this is very important from point of view of the formation of the blood-retinal barrier. We have other functions as well. Here we have the choroid with the blood vessels, of course, and then the pigment epithelial cells will obtain some nutrients, oxygen, and vitamin A from direction of the choroid, and this is possible through the epithelial transport happening on the basal side of these cells. It is very important that we need vitamin A because that before mentioned retinol, the prostatic group, is the aldehyde form of the vitamin A, and for getting retinol in the rhodopsin and in the iodopsin molecules, we should have this vitamin A. Furthermore, we have a very important function. This is secretion of growth factors like the VEGF, which is the vascular endothelial growth factor, and it is very important from point of view of retinal pathologies, and I will show a slide about that a little bit later. But not only VEGF, but other growth factors will also be produced by the pigment epithelium. If we go in direction of the optic nerve, we will find these two plexiform layers, which we have already seen previously. So this is the inner one here. This is the inner plexiform layer, and that is the outer plexiform layer. And in this case, we have synaptic connections. In between, we have the the inner nuclear layer, and in this inner nuclear layer, we have cell bodies of different structures. First, we have here the bipolar cells. We have here the rod bipolar cells and the cone bipolar cells. Rod bipolar cells are in connection with rods. Cone bipolar cells are in connection with the cones. Plus here we do have the interneurons, the horizontal and the amacrine cells. Here, in case of this sketch, we can see these synapses. Here we have the synapses of the outer or external plexiform layer. In this case, we have synapse between the photoreceptor cells and the corresponding bipolar cells. And besides these, we have also the horizontal cells here, which are members of the horizontal transmission, and then they are also found in these synapses. Then we have the internal or inner plexiform layer here. Here we have connection between the bipolar, and here we have the axon of the bipolar cell. These were the dendrites. So here we have the axon of the bipolar cell, which is in connection with the dendrites of the ganglion cells here. And we have the possible version of this route when the amacrine cells will, or the amacrine cell will receive the information from the bipolar, and the amacrine cell will conduct it further away in direction of the ganglion cell. And this amacrine cell is also part of the horizontal transmission. The horizontal transmission itself is very important from point of view of color enhancement, contrast enhancement, and color discrimination. And here you can also see why our retina is inverted. The light should go through almost all layers. Of course, the only one exception is the first one, the pigment epithelial layer, in order to reach the photopigments in the outer segments of the photoreceptor cells. If we see the third neurons of the visual pathway, they are the third neurons of the vertical transmission route. In this case, we have these ganglionic cells. They are found not only in one layer, but their components are found in three different layers. This is the layer where we have the cell bodies, and here we have the dendrites in the plexiform layer, and then we have the axons already in the nerve fiber layer, where the fibers of the later optic nerve are running. From the ganglion cells, altogether we have approximately 1 million. We distinguish more types. We have a special type, which is the intrinsically photosensitive retinal ganglion cell. We have quite few from these cells, but they are already photosensitive in contrast to the other ganglion cells. They are photosensitive like the photoreceptor cells were, and they contain also a photopigment called the melanopsin. From these cells, connections will start, and these connections serve different functions like the circadian rhythm or the pupillary control or the conscious sight. If we see the other cell types found in the, or whose cell bodies are found in the inner nuclear layer, we see here the Müller cells, and these Müller cells are the retina-specific glial cells. They form the before mentioned limiting membranes, both the external one and the internal one. In case of the internal one, we have tight junctions between the end feet of the Müller cells, and they will separate, therefore, totally the retina from the vitreous body. The Müller cells are so-called radial glial cells. It means that they extend the entire thickness of the neural tube. Hence, they could have a very important role during the development when they have a migratory guiding role. But not only during the development, they are important, but later as well, very, very important, because they support the function of the retinal neurons. They support the synaptic activity with the neurotransmitter recycling. They control the metabolic activity of the neurons. They play a very important role in the ion household. And they are also participating in the formation of the blood-retinal barrier. Quite new information, not too new, but not too old experiments have revealed the role of the Müller cells in light guidance. These Müller cells can conduct light like the optical fibers. It is so that if the Müller cells are hit by the light, they can lead the light towards the photoreceptor cells light, and then this function is similar to that of the optical fibers. This is a very efficient function of the Müller cells. If we examine the eye, if we illuminate in the eye with the so-called ophthalmoscope, here we will see the fundus of the eye, and this is what we will see. This is a photo, and here this is an atlas image, and here we will see more very important areas. Here we have the yellow spot. It has a yellowish color because of the lutein content of this region, and inside this macula lutea or yellow spot we will have a smaller pit, which is the previously mentioned fovea. This is the central fovea or fovea centralis. This is the area of the highest visual acuity. This is the site of the sharpest vision. This is the site of the sharp vision. We have here the optic disc or blind spot. This is called the blind spot because this is the site where the fibers of the optic nerve leave the eyeball. Therefore, here we do not have any photoreceptor cells. Hence, we could not see anything with this spot, with this area. Therefore, it is called the blind spot. Here is also the entrance of the central retinal artery and the exit of the central retinal vein. If we see the fovea centralis or the central fovea, this is the central retina. Here we have only cones, so no rods are found here. These cones are very characteristic here because they are longer, slimmer, they are very dense here, so they are very close to each other. We have also Müller cells in the middle, in the so-called foveola, in the middle, and only these Müller cells cover these cones, and they prevent the reflection of light here. The further layers, what we have already talked about, are displaced here. So this is why we have this depression or pit-like structure here. So the further layers are displaced. You can see it here. Because of this arrangement, light reaches directly the cones, and in this area we don't have any convergence. The here we see that we have this arrangement here. One cone will form synapse with one bipolar and this one bipolar cell with one ganglion cell. So this proportion is visible here. So here we have the function of color vision and detailed visual perception, and this is the site, as we have already said, the highest visual acuity. And here, so twice, and this is very important that we have no convergence here. In case of the fovea, we don't have blood vessels. This is an avascular zone here. If we see this slide, here I can show you what convergence means. Convergence means that in case of the peripheral retina, which means outside the fovea, more photoreceptor cells synapse with less bipolar cells, and these less bipolar cells synapse with few, more or less, ganglion cells. It means that here we have loss of information. In contrast to the peripheral retina, in case of the central retina, one cone synapses with one bipolar cell, which synapses with a ganglion cell whose axon will leave the retina as fiber of the optic nerve. So here we don't have loss of information. This is the reason why with the fovea centralis we can see sharp and we do not lose any information. Here we see these layers again. I will not list all of them again, but here you see the photoreceptor outer segments, both rods and cones, and then the light comes in and the signal comes so out. Okay, so this is the inverted retina. In case of the blood supply of the retina, we should mention two different sources. They are, we have the choroid. You have already heard about the structure of the choroid. Here, not the innermost is the Bruch's membrane, but the next layer after the Bruch's membrane is the choriocapillaris. And here we have the capillaries of the choroid. From this direction, the outer layers of the retina will be nourished. In case of the inner layers, in case of these inner layers here, we have the before mentioned central retinal artery. The central retinal artery enters the optic nerve and is led into the eyeball, so, and then these arteries will supply the inner layers. The choriocapillaris, getting blood from the ciliary arteries, will supply the outer layers. Here we see these, you don't need to know these branches. I want to show them only because of the blood supply and because of that thing that we can see these blood vessels. In case of the ophthalmoscopic examination of the fundus of the eye, it is clinically very important that this is the only site in the human body where we can observe the blood vessels. And if we have some pathologies related to the blood vessels, this is the thing what we can see here in the fundus of the eye. The other thing is that what we have already emphasized, that the retina is part of the central nervous system, the retina and the optic nerve. Therefore, around the optic nerve, we have the meninges, but not only the meninges, but we have also the subarachnoid space, which is filled with the CSF. Therefore, if we have any pathology in the intracranial cavity, which elevates the pressure inside, so which elevates the intracranial pressure, it is also visible in case of the fundus of the eye. This is what, and this is here visible. This is the so-called papilla edema. And if we see this here, this is the normal fundus. And if the pressure is elevated, we will see this. So we do not see the sharp contour of the papilla. Here we have some changes of the fundus of the eye. You don't need to know them, but it is only for showing how important the ophthalmoscopic examination of the retina is. And I wanted to say a very few words about this VEGF, what we have already mentioned. This is produced by pigment epithelial cells, among others. And this VEGF is for angiogenesis. So it stimulates the blood vessel formation. But we have some retinal pathologies where the blood vessel formation is the very serious part of the disease, which should be decreased. And for this, we can use anti-VEGF drugs, and they are injected intravitreously, and then they will decrease the blood vessel formation. Hence, the disease or the condition of the patient could be improved. We have already mentioned the blood retinal barrier previously. We distinguish the inner blood retinal barrier from the outer from the inner. The outer blood retinal barrier is made by the pigment epithelial cells, which are connected to each other by tight junctions. and these tight junctions will give the outer blood-retinal barrier. The inner blood-retinal barrier is given by tight junctions of the endothelial cells, of the capillaries of blood vessels in the retina, and they are in the vicinity of the Müller cell processes. Another important clinical relation is this retinal detachment. This is what you have already heard in case of the lectures of Dr. Kish. In this area, we have the gap during the development. This is between the first layer and the inner 9 layers of the retina. And then here we find this intraretinal gap or intraretinal space. And in this area, between the pigment epithelial cells and the photoreceptor cells, we do not have any firm connections, but we have a matrix, an interphotoreceptor matrix made by proteoglycines, which are for the connection, but it's not a real connection. And therefore, if we have this retinal detachment, these 9 layers will be detached from the pigment epithelial layer. So the pigment epithelial layer remains in the eyeball wall, but the 9 layers will be detached. It is very important that ophthalmologists could solve this problem with laser, but only if the patient arrives in time. They are the possible ways for the investigation of the retina. This is the ophthalmoscopical examination. This is how we could observe information on the fundus of the eye. This is the OCT, optical coherence tomography. This is very important. The layers are visible in this case. The fluorescent angiography gives information about the blood vessels. Of course, ultrasound could be done, and this electroretinography serves information about the function of the retina. Thank you for your attention.